This is Savannah Richardson, and I decided to do my teaching plan on falls. And the reason I chose falls were because it's something that our nurses and our patients are facing a lot in the hospital. Each year, 700,000 to 1,000,000 patients fall while they're in the hospital. I feel like a lot of these falls are preventable. These falls in our elderly patients, they lead to a lot of comorbidities. They lead to lacerations, fractures, internal bleeding. They can even lead to death. And that's just really sad that something as simple as a fall can cause our patients to die. I chose my teaching for Lisa Ray, and my assessment on her for falls, her risk factors are advanced age, which is a big risk factor for falls. Usually they're over 80. Another one is hypotension. She was disoriented related to the hydromorphone administration. She also had a history of falls and generalized weakness. Some of these risk factors put her at a great risk for falls. Her diagnosis was hypotension and mechanical fall. My planning for Lisa Ray, we want her to maintain free of any falls during the length of her hospital stay. The implementation, we want to monitor her activities every 30 to 60 minutes, preferably because when we're checking up on them more often, it decreases falls because we're going in and checking on them. They're not having to get up to get to something they can't reach or needing to go to the bathroom. We want to remind our patients to call for help. And I feel like a lot of patients get up by themselves and they fall because they feel like they're bothering us or something like that, and we need to just remind them that they are not a bother. That's why they're there at the hospital, and they need to call us for help. We want to make sure their bed is locked, make sure that their chairs are locked, because that causes a lot of falls. When somebody sits down in a chair, it slides out from under them, or the bed slides out from under them. We want to provide our patients a walker or a cane to assist them with walking. We want to encourage them to wear their eyeglasses and their hearing aids if they have that, so they're not disoriented. We want to go in at least every hour or two and check on them, make sure they need to go to the bathroom, because if they're needing to go to the bathroom and they're restless, they're going to try to get up and go by themselves. We want to provide adequate lighting so that they can see the floor and see what they're walking in front, what's in front of them. And we also want to keep the floor free of clutter because we don't want them tripping over something. We want to always leave the call light with them. We don't want them to need something and then them not be able to reach their call light. We want to orient the patient to their environment, make sure that they know where they are. That helps them out because a lot of elderly patients, when they are at home and they're all of a sudden put in the hospital, it kind of sends them into a shock and it disorients them and gives them kind of like a dementia effect, and so it confuses them. We want to place all of their stuff that they need within reach. Anytime we leave the room, ask them what they need and make sure it's all within reach. Make sure that their handrails are up. At the end of the stay, at the end of the hospital stay, we want to evaluate and make sure that our patient Lisa Ray remain free of falls, and anytime during her stay we can change our implementation strategies and change our nursing plan. All right, that's all I have. Thanks.